Welcome, everyone, to a deep dive into a fascinating and sometimes uncomfortable condition known as exostoses, or more commonly, surfer's ear. This isn't your typical ear infection, so let's explore what makes it unique and how to protect your hearing. So, what exactly causes surfer's ear? The primary culprit is repeated exposure to cold water and wind. Think surfers, kayakers, divers, anyone spending considerable time in these environments. The cold temperature triggers a protective response in the ear canal. Now, let's get a little technical. Pathophysiologically, the cold water and wind stimulate bone growth in the ear canal. This isn't a cancerous growth, but rather the body's way of trying to protect the eardrum from the harsh elements. Over time, these bony growths, called exostoses, can narrow the ear canal. While precise global figures are hard to come by, surfer's ear is most prevalent in regions with cold water climates and populations engaging in water sports. Coastal areas in California, Australia, the U.S., Canada, for example, report higher instances of this condition. The signs and symptoms of surfer's ear can be subtle at first. You might experience increased earwax buildup, difficulty clearing water from your ears after swimming, more frequent ear infections, and a gradual decrease in hearing in the affected ear. In severe cases, the ear canal can become almost completely blocked, leading to significant hearing loss. Diagnosing surfer's ear typically involves a simple examination by an otolaryngologist, also known as an ENT doctor. They'll use an otoscope to visualize the ear canal and identify the presence and size of the bony growths. Audiometry, or a hearing test, may also be performed to assess the extent of any hearing loss. While we don't classify surfer's ear into strict types, we often categorize it by the severity of the blockage. Mild cases have smaller growths with minimal blockage. Moderate cases involve larger growths causing some blockage, and severe cases feature near complete or complete blockage of the ear canal. For mild cases, often no treatment is immediately necessary, but monitoring is crucial. For moderate to severe cases, surgical removal of the exostoses is often recommended. This procedure, typically performed by an ENT surgeon, involves carefully removing the excess bone to widen the ear canal. Recovery usually involves keeping the ear dry and avoiding water sports for a period of time. Prevention is key when it comes to surfer's ear. The simplest and most effective method is to wear earplugs specifically designed for water sports. These help keep cold water and wind out of the ear canal. Additionally, wearing a wetsuit hood or swimming cap can further protect your ears from the elements. The prognosis for surfer's ear is generally good, especially with timely intervention. Surgical removal is usually successful in restoring hearing and preventing further complications. Ongoing research focuses on improving surgical techniques and developing more effective preventative measures. Scientists are exploring different materials for earplugs and investigating the genetic factors that might predispose some individuals to developing exostoses. Remember, protecting your ears is crucial for maintaining your hearing health and enjoying your favorite water activities for years to come.